Hi, welcome back to IU Radiology Case of the Day. My name is Tim Tsai, and I'm a fourth-year resident at the Indiana University School of Medicine. Today, we've got an interesting musculoskeletal case. I'd like to give a shout-out and thanks to Dr. Ladd for her help, and of course Dr. Kuntz for organizing the entire Case of the Day initiative. Just a reminder that all educational content has been fully de-identified to protect patient privacy. For the history on this case, we have a 16-year-old with knee pain. Here are the images. From the left to right, we have a sagittal fat-suppressed proton density, sagittal T2, coronal stir, and coronal T1 images through the knee. Go ahead and take a look. Okay, so what are the findings? What's in your differential? What is the diagnosis? And what would be your next step? Let's go over the images. Here, we can see in the distal femur that there is a focal, starburst, or flame-shaped area of periphyseal edema. Looking at the other sequences, there isn't an anatomic abnormality. Coronal stir demonstrates the periphyseal edema, but again, no other abnormal finding is evident. Here, we have a case of focal periphyseal edema, or a FOP zone. This refers to focal bone marrow edema centered around a closing physis, usually involving the distal femur or proximal tibia. This is an entity of uncertain clinical significance, as it may be asymptomatic or associated with trauma and/or knee pain. There are some hypotheses that these FOP zones represent the normal physiologic process of skeletal maturation. As for the differential of pathology involving the physis, there are a number of more common entities. Infection could be considered, particularly in adolescence. However, more dramatic findings of edema and fluid collections would be expected, as well as presentation with infectious symptoms. Malignancy, such as Ewing sarcoma, could also involve the physis, but would also have more aggressive appearance with bone destruction or permeation and typically an associated soft tissue mass. Trauma, such as a Salter-Harris injury, can alter the appearance of the physis, though usually this causes widening or narrowing, and often with an associated vertical fracture rather than just focal edema. A chronic stress injury of the physis is more likely to demonstrate physeal widening and may be without periphyseal edema. As for treatment, FOP zones are self-limited, and rest and symptom management is standard. Invasive diagnostic procedures and follow-up imaging is not typically necessary. So for more reading about FOP zones, I'd like to recommend this paper. And for more fun with the physis, I'd also like to recommend this excellent electronic presentation. So to sum it all up for FOP zones, we have focal marrow edema around a closing physis, generally about the knee, which may be physiologic and may be symptomatic. It's mainly important to recognize as an entity that doesn't require invasive treatment or any follow-up. So as always, thanks for tuning into the IU Radiology Case of the Day. You can follow along on Twitter at NAKuntz, and you can check out our complete collection of Case of the Day materials at the link below. Thanks so much and have a great day.